I'm John Gannon. I'm coordinator of the International Network of Justice Improvement Organizations, better known perhaps as the INJIO. And it's an honor for me on behalf of the INJIO to welcome all of you to this webinar presented by Upneet Lallii. As you know from the registration form, Dr. Lallii is Deputy Director and Head of the Training and Research Wing of the Institute of Correctional Administration in Chandigarh, India. Dr. Lallii has degrees in law and psychology. She's written training manuals. She's served by invitation as an expert for UN drug and crime committees, and she trains prosecutors and senior prison and police officers. As we know, drugs are a serious problem, and it'll be excellent to hear from Dr. Lallii on this topic. There's always crises in the world, and our times are no exceptions. None of us can fix everything, but each of us can fix something, and each of us can improve something in our own local areas. As you might guess, our sponsors today, the International Network of Justice Improvement Organizations, is working to connect people and associations that are interested in advancing justice and justice policies whenever and wherever they can. The power of networks to affect change has been deeply misunderstood and underestimated. And it's our goal in the network to bring out that power and to demonstrate that community life can be improved by the members of those communities. We don't need to wait for huge funding inflows or international organizations for us to get started. And one of the best ways of improving your community is by the advancement of justice within that community. If you want to know, you'd like to find out more about how to, more about our Global Justice Neighborhood Project, more about how to bring out the possibilities of better lives in your community, please go to our website, globaljusticrc.org, or copy the information that's in the chat and register as a member of the INJIO. You'll be joining a group of like-minded people eager for change, just like you are. But now let's welcome Dr. Lallii. Upneet. Take it away.
Thank you so much, John, for your words of introduction. And it's a great honor for me to be a part of this network of INJIO and also a speaker in the webinar series that you have chalked out. And I recall, while working towards the certificate course of correctional psychology, how we've been brainstorming on various aspects to cover. And one of the issues was on drug and substance abuse. So here I am today talking to a wide audience, and I would say that I would just touch upon some of these issues about the 10 things you need to know, along with some thoughts. And of course, I'll welcome any questions that you have that you will put in your Q&A. And the experiences of the kind of drugs used would vary from region to region. But the purpose of this webinar is to give you an idea, an overview about what are drugs, what are harmful substances. And I'll start sharing my screen now. And hopefully we'll get this through in terms of, okay. So I hope you can all see the screen. A lot of people have misconceptions about what drug use is or what abuse is and what addiction is. The terminology is used. So the first part will focus on the terminologies and the identification of whether a person is a drug addict. A lot of issues come about with the different types of drugs and the harms that they cause and the impact that different drugs have. What are the risk factors that could lead to drug abuse? So the first part will be focusing on the general information. And then we come down to drugs in the justice setting, particularly in the prisons part. We do have a huge problem in some states and in some countries regarding drug use in prisons. How do we handle that? The evidence-based practices that have emerged and the focus that has now shifted towards differentiating between drug users and also persons who are addicts in prison, and what are the strategies for managing the drug abuse and the principles of harm reduction. So various strategies that are there with a particular focus will be on harm reduction and the challenges that occur while dealing with drugs and drug and substance abuse. How many of you would have used a drug? We've all used drugs. We've all used substances which have affected, if somebody is not well, we take a paracetamol. So we have used a drug, and that's known as use without experiencing the negative consequences. So in that way, all of us use drugs. But when does it become misuse? When the drug is used for a purpose that is not either legal or is not consistent with the medical guidelines. Using cough syrup, let us say, which should be there for avoiding cough or for treating cough for any other reason or for getting a high, or using sedatives in a larger quantity. That's the misuse of drugs that occurs. Drug abuse happens is using these drugs or prescription drugs or over-the-counter drugs for purposes other than what they are meant to be used for. And in large amounts, if the doctor has prescribed one dose, taking an overdose of that, so that leads to drug abuse as such. And when does addiction happen? What is drug addiction or substance use disorders? Now, we do have a clear-cut definition of drug addiction and substance use disorders. You have the International Statistical Classification of Diseases, which does define drug addiction and says that whenever the person realizes that this is causing me harm, but the whole focus becomes on obtaining the next dose, and there is no control left, and that is the time we say that drug addiction happens. So it's a whole range of psychoactive substances which lead to dependence, increased tolerance, increased dependence. And also there could be different classes of drugs for which there could be addiction to. So when the person starts taking drugs in a larger quantity, the persistent desire is there that you want more, you don't have control over that. And a great deal of time is spent on using of drugs. So that's the time when we say that addiction happens. It starts as not the first time somebody takes a drug, you don't become an addict. It starts with experimentation normally. And speaking from what I have seen dealing with, let's say students or others who are in the de-addiction center, it starts with experimentation, could be an occasional or irregular use sometimes. So friends say that, okay, take this, try this out. It starts with an experiment, becomes as an occasional. Sometimes the person starts taking alcohol on a regular or an occasional or irregular use. Then it becomes a regular use. Then you want it on a daily basis or whatever. And then the addiction or dependency happens. Now, how does this happen? The pathway to drug addiction then, and some drugs may lead to, the transition may be very quick from just experimentation to becoming an addiction. And you have various kinds of drugs which are existing, and you have more chemical drugs which have come up, pharmaceutical drugs, which are causing increased addiction and dependence. Now, what do we call as addictive substances? When does every drug lead to addiction? No. Does every prescription, you don't get addicted to certain medicines, let's say, but you do get addicted to certain drugs which cause a change in consciousness, a perception. Cannabis leads to change in perceptions. There will be hallucinations, visual hallucinations that may be there, auditory hallucinations that may be there. They also cause a change in the mood. Persons may take drugs and feel very good and euphoric and high. Ecstasy is one pill which would give very high to some people. It also affects the thinking process, not being able to make the judgments. And we find that a lot of people who may end up with the justice system, maybe because it has also affected their judgment and thinking process, and they've committed certain crimes because of that. There is behavior and motor function also, which is affected. Many times, you may see people lying on the street who have really no consciousness about where they are, resting and in what state they are in. And the whole focus is on just obtaining the next drug. So all these substances, addictive substances, they work on the brain and they change the different aspects. So each drug may have different types of drugs, would have a different impact either on the consciousness or the perception, the mood. Some will give a high, some may give a low. The thinking process would get distorted. Not being able to walk straight also, sometimes you see when you've drunk too much alcohol, you may not be able to drive safely, and you will have the cop saying, coming out and say, walk in a straight line, and people not being able to do that. So all these drugs, addictive substances, do have the ability to change all these aspects of an individual as such. What are the different types of addictive substances? And when I said that we have all consumed some drug or the other, I don't think I've been wrong with that, because a lot of people would be taking, and not everybody would become an addict by taking these: alcohol, tobacco, cannabis, sedatives, different types of hallucinogens, stimulants, opioids, depressants, and volatile solvents. It's really, every year you come across some new drug that has been developed as well. So it's this may not cover all the types of drugs, but this is the broad category of addictive substances that are being used currently. And you keep having a variation also in these. And and when we say that drug use is a health issue, it's not just a matter of control where you say that, okay, a person may have, it's just a matter of willpower and you can give it up. Most of the times you see that there is a failure in that. Why? Because the addictive substances act on the brain. Not all substances acting on the brain, they are not addictive, but the addictive ones are those which act on a particular group of neurons in the brain. So I'm not going deep into the physiological part, but let me tell you this, that these affect the brain circuits, which are important reward centers. There's a surge of dopamine, which happens when a person takes an addictive substance and the person feels a high. You would feel a similar high if you were to take a walk or exercise, but that comes later. But herein, it is an immediate rush that happens, and it affects the connections, the neural connections as such, and different parts of the brain are affected through the usage of different drugs. Advances in neurosciences have led us to see how the various parts of the brain are affected through the use of addictive substances. And what it does lead to is that the individual has to repeatedly take the addictive substance, and the behavior becomes totally focused on getting the next dose of drugs. So if a person is taking, let's say, 1 milligram or smoking 1 joint will want more, and the whole focus becomes on obtaining the next drug, next dosage. And this is because the brain has been affected, and the circuits are changed forever. So this is where the individual in the treatment part does need medical interventions. And it's important to understand that drug abuse cannot be treated just through counseling or just telling the individual that stop taking the drug. It is a health issue which does require different aspects of treatment as well. So the various reward pathways that get affected, it could be various areas depending on the drug and the kind of different combinations of drugs, and also the frequency of drug usage. All these parts of the brain could get affected related to learning. And the sooner, at younger age groups, when you're finding adolescents who are using drugs, that their whole the brain growth the cognitive growth gets affected, and their attention process gets affected. So there is a whole lot of physiological changes that are taking place, emotional and behavior. Could be a lot of aggression that you see. And tragically, one sees at times, people murdering their own parents or family members in the pursuit of drugs. Now, a normal individual may not end up doing that, but a person in an intoxicated or in a drug-addicted state could end up doing that. And control of body movement. And you would see there are if you could just do a Google search, you'll see the images that are there in terms of how addiction has affected, and from where a healthy body is there, you would find that the total change in the personality, in the physique of the individual also taking place, apart from the speech part of it and the attention and the autonomic functions that are there. When we look at prevention part, I always stress that there is really no safe high. You cannot say that, okay, you are taking this much dose and you are safe as such. A lot of deaths do take place because of drug overdose as well. And in combination, certain drugs could be very, very deadly as well. So in the prevention part, in the community, when you're all members out there, I think it will be very important to emphasize on this aspect that there is really no safe high as well. So the first part, when we look at the physical dependence, which starts as a sign that, yes, a person is moving on to addiction, is the person is wanting more dose, and it's creating a physiological, you can't sleep without it, you can't get up without it. So alcoholism is one thing where you notice that it's more common, where you find that the person does need, a drink to get up from the bed in the morning, or can't sleep without that. So there is that physiological reliance on the drug that happens. Do we get addicted to tea or coffee? Yes, we do get addicted, that you can't do without it. So your body wants that. So there is that physical dependence that happens. And addiction, so tolerance levels are when you need higher doses to achieve pain relief or any euphoric response. As I mentioned earlier, drugs do lead to addictive substances, do lead to change in the not only the cognitions, but also in terms of mood elevation. And addiction happens when there is, it's a relapsing brain disease, and the person has to pursue that next dose. A lot of times there could be, there many times there could be an overdose, which could result in death. And I've seen instances where persons who have just been released from the prison, and since they may not have got the dose, but once outside, or they would have been treated, and they were treated in the de-addiction center. But after a few days, they have died. And this is also because of the drug overdose. So once the body may not be able to cope up with that. You do find withdrawal symptoms very common when the individuals are not able to get the drug. What happens to them? So a person gets arrested, no drugs in police custody, and the person comes into prison, and there could be issues where, or even otherwise in normal life also, there could be individuals who may want to give up drugs on their own, and that's why medical intervention is needed. But they may face, they would say they're having a lot of pains and aches in the body, or bloodshot eyes, or nausea. So there are a whole, or splitting headache, and sometimes it may get so worse that they may end up banging their head against the wall, literally. These are all signs of withdrawal symptoms that come from stopping the drug or reducing, and particularly for opioids, we've seen that withdrawal symptoms are extremely severe. And there could be worsening of pain also following a therapy that happens. There are long-term changes, as I've mentioned, that happen to the brain, that particularly the portion, the cortex related to the decision-making and the behavioral regulation that happens. So the whole physiology changes because of the usage and the misuse and abuse of drugs that happens. Different types of drugs that exist. There are stimulants, which stimulate us. All of us want a cup of tea or coffee, and only the healthy ones like John will be having juice or something. So there could be and what does the tea or coffee have? It has caffeine. Coca-Cola has caffeine, and a number of people get addicted to Coke because it gives them a high. They feel good about themselves. Cigarettes have nicotine in them. Amphetamines, speed, cocaine, diet pills, they are all examples of stimulants that speed up the central nervous system. You feel more active, more energized, and people feel more good. So these are stimulants, which are one category of drugs. Depressants are other category of drugs, and you have different types. So normally people assume that when you have a celebration that you drink alcohol, you feel good about it. But alcohol slows down the brain. It slows down the nervous system. So it's not a stimulant. It's more of a depressant. And opium is also a depressant. It is not a stimulant. Heroin, which is a derivative of opium, is a depressant. Sleeping pills, tranquilizers, these all slow down the brain. And the brain is not able to process information as quickly, is not able to act upon as quickly as well. And then you have also alcohol. I mean, I'll just deal about that. And a number of times you find people saying that alcohol is not addictive as well. But so many alcoholics you find, and you have the AA also. It affects both physically and mentally and emotionally. The coordination is not there, and you all see in gatherings where people have drunk too much, that they were not stable in their walk, their slower reflexes. It damages the heart, it damages the liver, cirrhosis of the liver in extreme stages of alcoholism, and it can be very life-threatening when mixed with other drugs. It also leads to changes in the emotional states. A lot of domestic violence cases, and talking about particularly from India point, where we see that alcoholism has led to increased domestic violence. And there is obviously the problem, social and family problems that emerge from any drug or alcoholism use that happens because of differences that take place. So there is an increase in violent behavior because of alcoholism. And if children start taking it, if adolescents are taking it, the brain grows up to the age of 25 years, the neural growth that happens. And all this gets affected through the use of alcohol. A lot of times people assume that, it is not leading to any changes in the brain, but it is very harmful and there will be problems with school and learning. And various countries have various ages decided for the use of alcohol. So from India point of view, I'll say it's 21 years that it is allowed. That's a legal age of drinking that's mandated. So in case countries have up to 18 years, but most of the times what you find that children may be consuming alcohol at their parties, and mixed with drugs, it is extremely deadly. And juvenile, we have people from the criminal justice system, from the police, and you would find that juveniles would have indulged in a whole lot of delinquent behavior because of this. So different kinds of drugs have a different impact on various parts of the brain and the body. Opioids lead to more of respiratory diseases, and there is a death risk because of overdose. Inhalants, which are easily available over the counter, people don't have to pay too much for it. And we find that a lot of street children use inhalants, whether it is thinners or even correction fluids I've seen that are being used by street children. They damage the lungs, the liver, the heart, and the kidneys from long-term use. So their usage has now become a little bit restricted, that correction fluid is not to be easily made available. But different countries would have their own policies in terms of dictating what are the legal drugs that can be used, whether you legalize it or criminalize it. Marijuana is one point where there has been a whole lot of controversy, and you've had many countries legalizing marijuana use. You have some states in United States also which have legalized. Canada has legalized marijuana use. But it is leading to a risk of respiratory system, memory losses there, learning problems are there. And what has been found is that there is a risk of psychosis. In fact, the World Drug Report of 2022 has shown that there has been an increasing use of marijuana, of cannabis as well. And there is in the younger age group, and it is leading to increased psychotic disorders like schizophrenia. So there is hallucination, there is paranoia, and there could be frequent and larger use could also lead to death due to overdose. With ecstasy pill, which is highly expensive, which is prevalent more in countries which can afford it. But yes, there is a risk of liver failure and heart failure, and combined with alcohol, it spells death. Cocaine, which is again a very expensive drug, and it is leading to risk of heart attack, stroke, and seizures. Can you recall any famous Hollywood personalities who have died because of drug use? A lot of it's very common in sports persons. It's common in Hollywood stars, Bollywood stars who use drugs for either their performance or to feel good about themselves. We've had Michael Jackson dying, Whitney Houston, and a whole host of other persons, figures who internationally renowned, who have unfortunately who have been addicts and have died because of the drug abuse. Another thing which is now becoming more prevalent worldwide is the methamphetamines, which are now being used and synthetically manufactured. There is a risk of psychotic behavior from long-term use. E-cigarettes, I've just put this, they are being used in some places as alternative to nicotine dependence, but this is also found to be harmful. Around the world, 284 million people in the age group of 15 to 64 years have used drugs once in their lifetime. But despite knowing that drugs are harmful, why do people take drugs? That's a question that is always asked, that we know, everybody knows that drugs do damage, but why do people end up taking drugs? And when do people end up taking drugs? People use drugs to feel good, to have new sensations. And a lot of times they feel that you can be creative only while taking a drug. It is also related to the peers that are there. The peer group becomes very, very important in terms of pressurizing individuals, or to feel in the group that individuals end up taking drugs. There is also that thing to feel better, to lessen anxiety. Okay, I'm feeling anxious, and the misuse of drugs starts happening. To deal with depression, hopelessness, fears, all these could be a reason for people to take drugs. And the risk factors are there in case people have had a traumatic childhood, in case there has been child abuse. There will be more risk factor in case anyone in the family is taking drugs. There is a higher risk of drug addiction happening, because A, there is easy availability, and B, you find that somebody is doing it in your own home. So the role model itself is there in front of you. So either they could turn away or turn addicts as well. And there could also be examples where we find that when we talk in terms of prevention, a lot of now focus, in fact, programs which have found to be very successful, deal with teaching adolescents self-assertion skills, being able to say no to the use of drugs, so that they don't feel they have to be in with the group. So the reasons, both outside, that is outside the prison, and inside the prison, I'm focusing on that part also. The reasons remain similar. There is peer pressure. There could also be curiosity. Let me try it once. How does it feel? Everybody says that, this person is doing good. Loneliness. People want to feel to be in the group also, to avoid loneliness, to escape from reality, not getting a job and frustrated and thinking that, yes, you can cope with this. Low frustration tolerance is another reason that people may be experimenting with drugs. Depression and anxiety. And having drug using friends is a very key and important component, which can reveal whether persons are using and experimenting with harmful substances. So if you find any of these, if the friends of a child are using drugs, there could be that, yes, there could be likelihood that, yes, there is a chance that the child may end up using drugs. And you find that there is, in adolescence particularly, we say school dropout behavior, not having such friends. So all these indicate that, yes, there is a risk of the child getting into drugs and harmful substances. The harms that drugs cause, the whole wide array of harms that are there. Physical harms. Injecting drug users are more likely to have HIV, hepatitis. They could poor nutrition, and you find that there is, you just look at the photo of the individual after 2 years, and you find the face is totally changed. So there is a lot of weight loss that also occurs. Overdose, I've mentioned earlier, it can lead to death also. A healthy personality who has been very good. And in fact, once I was shocked to see someone who was there in an AA meeting and who was a very successful person, but became an addict. And his job, he was out of the job, and very good architect, but was out of it, was not able to focus, and was in that recovery state. So absenteeism from work increases. There is a frequent change of job, and may end up, in debt because of feeding the habit of drugs. The family and the social harms that are there, marital discord would be there. Stigma and discrimination are prevalent. Psychological harms are there, and legal harms, obviously. There is a chance that the person, even drug users in many countries still are, it's criminalized. In some countries it's decriminalized, but anybody dealing with drugs would be, in most countries of the world, there are very harsh penalties given for both drug use and for trafficking of drugs. There is a chance of involvement in illegal activities. What we find that once you start taking drugs in order to feed that drug habit, the person may end up being a carrier as well and involved in illegal activities. Now I move to the portion of drugs inside the prison. The best of prison systems in the world do face this problem of drug use in the prisons. And how do they get in? So there is really, I mean, human mind is very, very ingenious, and they can get inside the prison through any and every kind of a mean. They could be either thrown outside, from outside. They could come inside through even prisoners who use their own body cavities to smuggle in drugs. Even prison staff could be getting in drugs. And the global prison trends show that 2.2 million people globally are in prison for drug-related offenses. And out of these, nearly 470,000 people are in for possession of drugs for personal use or consumption. And this is a matter of concern. If we are putting in people who are using drugs, and if we are criminalizing them, are we helping them or are we harming them? And prisons are damaging. They are very, very damaging. And people in prison may end up using drugs. They may be users before. They may already be addicts. And they may become addicts inside the prison also. Because you are bored, you are miserable, you're depressed. It may start off with somebody offering you that, okay, take this, you'll feel good. And the prison environment has a lot of risk related to both public health. Injecting drug users are high on the risk for HIV and AIDS. And once these persons are released back into society, the disease could spread. There is also risk of reoffending. And if we look at the risk need responsibility aspect, so for individuals who are drug users, and if you're not dealing with the drug usage part of it and just punishing them and putting them in the prison for a few months' time or 2 years or 3 years, whatever, and once they are released back into society, in order to feed that drug, they would again commit a crime. So the risk of reoffending is very high. One of the main causes of recidivism is also drug abuse. And there's a risk to the security of the prison. We find that, you know, at times there have also been riots in the prison because of drug usage, smuggling in drugs, activities, illegal activities that occur, criminal activities that occur. So there is a risk to the security of the prison as well. And prisons, though not the best place for treatment, is also a place for treatment of drug addicts. Now, there are, you know, I would say that it's a real, you know, dilemma at times that happens, that people may not be able to access resources in the community for treatment, which may push them to think that prison is the best place for treatment. And this happens where health systems are less developed. So I'm talking from that perspective, which some of you may find it at odd and at variance, but practically in the developing world, I've seen that also happen, that prison persons may be pushed into the prison system because they feel that here at least, you know, there will be no supply and the person may get cured of their addiction. So just to put it shortly, briefly, drug addiction is a chronic brain disease, so it has to be dealt with medically. Recovery requires effective treatment. It has to be followed by continued care. very important part is assessment. And the WHO questionnaire, that is the ASSIST questionnaire, is something that can be readily used and is available, which can help the assessment part in terms of, it covers all types of, from alcoholism to other drugs, and how much is the intensity and frequency of drug duration. Accordingly, the drug use treatment can be worked out, and it has to be monitored. The focus has got to be not just on the detoxification part, but also on the treatment part, focusing on the criminal behavior. And there has to be a balance between rewards and sanctions. You punish, but you also reward and reinforce the behavior. A lot of individuals may have co-occurring mental health problems. They may be high on depression, or they may be psychotic disorders, which would require treatment. And if there are persons who are having hepatitis or HIV or TB, they would require treatment along with the de-addiction part. So the strategies that are mainly used are threefold in terms of demand reduction, that we find that you reduce the demand. A lot of focus was given first on supply reduction, and United States, I think, started with that war on crimes in the 80s, war on drugs. But it really did not end up very successfully, because the highest incarceration rate in the world was of the US, which again indicated that you needed to focus also on the demand reduction. And now there is an increasing focus on harm reduction strategies. So supply reduction, you reduce the supply, you minimize, you break the supply chain. And even during COVID, it was felt that, this could lead to less of drugs, but it did not happen. We ended up with a lot more addicts. And the survey has indicated that the supply chains were able to, again, move out. So, but yes, there is, and a lot of laws are there to reduce the supply, to minimize manufacture and distribution of illicit drugs. You have international protocols as well worked out for it. Focus on demand reduction is to have a range of policies and programs that reduce the desire, and that prepare that if you are using drugs, you go in for treatment. Harm reduction is where the focus is on reducing. You accept the fact that drugs will be there, and you reduce the harm that would be caused through the use of drugs without requiring total abstinence. So regulating the supply, where, let's say in case of alcohol, you feel that yes, people will take, but below a certain age will not be made available, or a certain quantity will be illegal to keep in the home. Medications available only through prescriptions. So those are all related to regulating the supply. And even though we have total prohibition in certain states, in India, I'll give an example, there is prohibition of alcohol. So they manufacture, sale, consumption of alcohol leads to people in the criminal justice system. But it hasn't worked. Total prohibition doesn't really work as such. And you do find that, yes, people will take drugs. And similarly, like prisons, we say that no drugs will enter, but still the drugs do manage to enter the prison. Looking at prison systems around the world, yes, it does happen that even in islands, I've seen that they will be having drugs entering the prison system. So, and it's something that has been there since centuries, that substance use has been a part, and zero tolerance hasn't really worked as such. I mean, we've not been able to eliminate substance use. So a drug-free society seems to be an impossible dream to achieve. And among them, so the persons who are at risk, we need to focus on those per individual. So harm reduction is one way of dealing with this situation. They are aimed at reducing the harm, which we feel is much more important than reducing the drug consumption. It's more realistic, rather than saying do at least be 50% or 80% successful at the target group as such. Some of the strategies in the harm reduction, which are prevalent worldwide, relate to needle and syringe exchange, educational interventions on how to use drugs safely, Needle and syringe exchange programs, they are existing even in the prison system in some countries where you have, like Iran, I was surprised they had that. Substitution, you have the opioid substitution treatment programs being run in various prisons. Methadone and buprenorphine are the alternatives that are given. There is this opioid use disorder, and for that we have the opioid substitution therapy, wherein the heroin or opioid substance is substituted with the medication part of it, with the agnostic medication, in a medically, in a safe manner, in a legal manner. And the focus is on, so the detoxification part takes about 7 to 10 days, followed by constant counseling. So there is the opioid substitution therapy. So normally it's a sublingual drug that is given. There are protocols that are followed, that the individual has to take it in front of the person and in front of the doctor or the nurse, and there is a full monitoring that takes place. I'm just seeing the time. So drug addiction is a chronic brain disease that affects behavior. What has worked also includes cognitive therapies. These are evidence-based interventions that have been found to be very successful, that teach both teaching and decision-making skills. Motivational therapies are really working in helping them to participate in the treatment and non-drug related activities. So you have to have not just the medical intervention, but focus has to be on peer support also and counseling. Tihar prisons, which are, I mean, Dr. Bedi had started that part where they had the ASRA project, where drug users themselves who were undergoing treatment became the peer supporters. And this part has been found to be very successful. It's similar to your Alcoholic Anonymous and Narcotic Anonymous. And counseling, these are the essential pillars. So medication is important since it's a brain disease, peer support is important, and counseling becomes important. Linkages with other organizations, community organizations, spiritual organizations do work very effectively. You'll have to see your culture, what fits in. And self-help groups are very important, not just for the drug user, but also for their families. So support, and also after release, the medical aspect has to be taken care of. The health part has to be taken care of. And I'll just share some of the pictures, which are old pictures, which deal with the community also and the prisoners forming that community and using something that works with them. So cultural activities work very effectively to spread awareness, to maintain motivation, and to also have that group support and the peer group support. This is something that each country, this is very low cost intervention, but this is something that gets them involved and that helps them motivate. There has to be proper monitoring. The relapse rate is really high. It's as high as 60%. So we are not going to be successful. There will be failures which will have to be dealt with. There will be frustrations. And if ever, there you find that, yes, drugs are entering in, or there is, even the substitute is being smuggled as such, the authorities have to monitor that, have to detect that, and take quick action on that part. So I'll just conclude by saying that you have to go much beyond the chemistry, much beyond pharmacology, and treat the whole person. The behavior therapies, the social services are going to be very important. And total functioning, healthy personality is one who's able to function effectively in the family, in the community, and at work at large. So I thank you, and I'll welcome the questions. Thank you so much. I hope I'm...
Upneet, there's a question in the question and answer regarding Kush or spice.
Yes,
do you want
that is more in UK prisons, which was being used. Okay, it's used in West Africa also. So we, I mean, in India, we are not having this, fortunately, this drug still as yet, to my knowledge. But as a family or a community, I guess it is the same, which goes for any other drug, is to create awareness about the harmful use. So that's important. And in terms of dealing with it medically, you'll have to have, those treatment programs and the mental, both psychiatric help would be needed, because medication part would be needed. But a lot of support systems would be needed to ensure that, yes, people who are trying to abstain do get the support that they need.
All right, Pius, did you have a question you wanted to ask? Let's see, I gave Pius permission.
Not really. I'm not sure if I raised my hand.
Well, your hand is up, but I can take it down. So it's
Oh.
now it's back up again. So I don't know what's going on. All right. Anybody would like to put a question in the question section down at the bottom? That's fine. I see there's one. Thank you, Pius. Bill, I would, with respect to that question, I'm not sure that Upneet would be able to answer that.
Yeah, I mean, the US war on drugs.
Yeah. I haven't seen any evidence of that, but the DARE program has been very popular and very counterproductive, so I wouldn't be surprised. Do you want to take a shot at that, Upneet? You know anything about the war on drugs stimulating drug use?
What one does read about it from the from some of the articles, etc., is that it did, push. So the drugs that were being used by the rich, I mean, it criminalized more of the blacks, and that's what one reads about it. And the cocaine and all became the rich people not using those, whereas the others, it did spur a lot of drug usage of another kind, I would say. But I don't know in terms of any evidence base for that. That it's not to my knowledge. But it has been a failure. What has been found, like Portugal has been an example where they decriminalized and they also made access to the healthcare part easily available right at the street clinics. They had mobile clinics which were treating drug addicts, and people could just walk in and get the treatment. So that worked effectively, and the imprisonment rate also went down.
All right, there's a question about CBD oil.
So some countries do consider that as a drug. So each country, you have your own laws related to drug usage, and there would be, certain things like kava is something that is used in certain islands, which is as a drug. In others, it's very culturally, it is deemed, tribal communities would take it as such. So but yes, it is a drug in the Indian context, it is a drug. So like we have a Narcotic Drugs and Psychotropic Substances Act, which gives you a whole list of psychoactive drugs, narcotic drugs, and the quantity which is permissible, and commercial quantity is something that is dealing with trafficking, and there are huge penalties and punishments for that.
All right, I think we are pretty close to the hour here. We've got time for one more question if anybody wants to submit.
One point I would like to say is that regarding the gender aspect, a lot of women who may be drug users, and this is across the world, I've seen it in Maldives and in Thailand and other places, that they may not get access to treatment compared to the males. So there is greater stigma attached to women addicts, and there are fewer facilities available for that.
Now, are you talking about in justice settings or in social settings?
In justice, both, even in social settings. because they so some, like in Punjab state from which I belong to, then they had a special hospital in one district made just for women addicts.
All right. Well, I would like to thank Dr. Lallii for her wonderful presentation today. And I'd like to thank all of the attendees. And we will be having a webinar on suicide in 2 weeks. So stay tuned. And I'll look forward to seeing everybody in a couple of weeks. And thanks again to Dr. Lallii for a wonderful presentation.
Thank you. Thank you so much.
Good night to
Bye.
everyone.
Thank you for patient hearing. Thank you so much. It's been an honor.